Tonight is all about how do we prevent colic, and I know you're going to be blown away by the information that Liz is sharing, because again, if we know the risk factors for colic, we can do a lot to preventing. And then what do we do if it actually happens? So for those of you who don't know me, I'm Linda Goldspink-Lord, and I am the founder of Poseidon Animal Health. And obviously this is Dr Lizzie McCready.
Amazing. Well, let's dive in. Before we introduce ourselves properly, I just want to make sure that everybody who's tuning in, and there's 133 of us so far, I just want to make sure that you're all in the right spot. So this is the right webinar for you if you're a passionate owner who just loves taking really good care of your horse and you really enjoy learning all about equine health. If you're potentially a new owner and you really want to fast track your learning and avoid making some of those painful mistakes. You might be an experienced owner who just wants to update and expand your existing knowledge or skills. A big shout out to all the equine professionals out there who want to advance their skill sets as well, so you can better service your clients. I'd love to also welcome any agistment or livery property owners, because you have the huge responsibility of taking care of other people's horses as well. So it's great that you're here. And I really want to welcome anyone who wants to feel more self-reliant and avoid any unnecessary vet bills. Anyone who lives in a remote area where it can be really hard to get a vet. Those of you that want to be hands-on while you're waiting for the vet to arrive. And also those of you who really want to safeguard yourselves and your horses from the impact of the looming vet shortage, which is something I don't have time to go into today, but definitely make sure you reach out to me if you want to hear more about that really important topic.
I just want to add to that what is amazing about tonight's webinar is that we often, when it comes to colic, it does create such fear and a sense of helplessness. And sadly, I'm one of the 30% that has lost a horse to colic. And I just remember the absolute fear. So then from that moment on, as soon as I see them pouring the ground, oh no, they've got colic. I mean, luckily it hasn't happened for a long time, but you want to ring the vet straight away. So tonight's about having Lizzie share her expertise on how do we prevent that from happening. And this is what makes this webinar different, because if we can manage the risks, then, colic is one of those things that can strike regardless, but we can manage the risks. So just wanted to share that as well. And the other thing is too, we do want to make this interactive. So Lizzie and I are going to sort of chat as we go through these. If you have questions, please put them there. If we don't answer all the questions, we always get them answered post-webinar, and we will send them out in an email as well. So in the past, we get so many questions, we can't get through everything, but we promise you we will get back to you ultimately. So really quickly about my role is obviously an animal lover. I've had horses all my life, and sadly, at a personal level, I had a really serious illness years ago. And despite having a master's in health education, I didn't really know what gut microbiome was. So I learned about that. I actually managed to heal my own illness. And then it was like, well, is it true of horses? Is gut health important for them as well? Little did I know 7 years ago that would lead to this moment in time where we have all these people coming to us to learn. We love everything about horses. We love gut health. And what we now know is the horse's gut is the foundation for everything. So I've taken that passion and that interest in gut health to really lead the way in what is gut health and how do we allow our horses to be the most incredible, magnificent animals that they really are. So that's all about me, and I'll pass it back over to you, Lizzie.
Amazing. And again, Linda, I'm one of those 30% of people that's lost a horse to colic as well. It was one of my sister's horses, and it absolutely broke us as a family. It was so challenging to deal with, and it's one of the things that really puts a fire in my belly when I think about all the other owners out there and really trying to prevent you having to go through that same experience. So a little bit about me. Obviously, there's 80% of you in here that have never come across me before. So I graduated from the Royal Veterinary College with honours back in 2016, and that's the main university for veterinary science in London. Now, from the very, very beginning, I'd always wanted to specialise as an equine vet, and I've been very passionate about offering the best care to my patients the whole way along. So I embarked on gaining a variety of experience and worked in a fantastic equine hospital back in the UK, as well as out on the road as an ambulatory vet, before I then decided to move to Australia in 2018 to work in a really busy first opinion practice. So not only had I experienced colic firsthand as an owner before vet school, but I learned to appreciate just how common it is, seeing it every day working as a vet. In 2022, I added another feather to my cap with a certificate in traditional Chinese veterinary medicine and acupuncture, which allows me to offer another approach to facilitate holistic care to my patients. And in 2021, off the back of physical burnout as a vet, I decided to start bridging the knowledge gap between vets and owners and empowering owners with the tools to better care for their horses and help avoid common health issues from occurring. From this, Empowering Equine Education and the Equine Emergency Response Training were born. And since then, I've spoken at Equitana, which is where I managed to meet Linda, and have been invited back in 2024. So hopefully I'll see some of you there. I've also been a guest on multiple podcasts and taught workshops both here in Victoria, interstate and overseas. And my mission today is to really elevate horse health and welfare through owner education and empowerment, all while helping to support the veterinary industry from the ground up.
So Lizzie, you're a low achiever.
I try. So let's delve into it. So why care about colic? So colic is one of the most common and painful conditions a horse can experience, and it is the most common cause of death in horses worldwide. It has a significant impact on the health and welfare of the horse, as well as for the individual horse owner, who can experience significant emotional and financial toll, which I'm sure many of you can resonate with. Now, it's the most common emergency condition requiring after-hours care by vets, which can be expensive, but also means that with the current vet shortage, horses with colic may be at risk of receiving delayed treatment. In one study that looked at 941 horses seen by first opinion vets, so that essentially these are your regular ambulatory vets, almost 24% of those horses had critical colic, which means they required either intensive medical therapy, surgery, or even euthanasia. So these figures show you that it's a really common condition that every owner should be prepared for and doing everything within your power to prevent. So what is colic? By definition, it's generalized abdominal pain. So it's actually quite non-specific, and it can be caused by more than 80 different diseases, the majority of which stem from an issue in the digestive tract. Now, the horse feels pain when the gut wall becomes stretched, which can be due to a number of reasons, such as an impaction, which is where the gut becomes blocked either by feed material, sand, or another foreign body. They can get spasms. They can get excessive gas production due to abnormal fermentation. They can get displacement, which is where the gut moves into an abnormal position, and then it can get stuck or twist on itself, which can then lead to things like strangulations, entrapments, torsions, and volvuluses. And horses can also get strangulating colic when the gut is obstructed by an external factor, such as an abdominal tumor like a lipoma, or if a piece of intestine drops into the scrotum, which causes a scrotal hernia. And lastly, colic can also be caused by inflammation. So we call those the enteritis, the colitis, and the peritonitis cases. Now, that's just scratching the surface. There are far more, but those are the main types that horses tend to deal with. So what are the signs of colic? Now, knowing and recognizing these signs are very important for all horse owners, because it is going to allow you to notice even the most subtle changes in your horse's behavior and allows you to get the vet involved as soon as possible. Now, it must be remembered that no two colic episodes are the same, and there's a lot of range within the nature and the severity of the colic signs. But I've written them on a scale here, starting with the early, going all the way down to the severe. So in the early stages, you might just notice that your horse has got a reduced appetite or not drinking as much water. They might be passing less manure, or the manure might look dry. Then they can progress to starting to lip curl or look like they're weight shifting. Then if you lift their top lip up and you look at the mucous membranes, you'll notice some tacky gums as we go into the mild signs, in addition to some bloating. And one of the really common ones is that they'll look like they're stretching out. You'll be thinking, God, they're trying to go for a wee again. But no, they're just trying to get comfortable, but it can look like they're trying to urinate. Flank watching is a really common one, where they look round at their belly, as well as kicking at the abdomen. So they'll be standing there kicking up their legs high, like we have this grey horse at the top. We then got pawing, restlessness, and then the horse will start laying down, and that will then progress to sweating, rolling, and thrashing as it gets more severe. And changes that you'll notice on your horse health assessment will be an elevated heart rate, as well as changes in the gum color and moisture, in addition to gut sounds. So we'll be delving into those a little bit later, but this is just a very quick skim over what the signs are. So you can make a note of these and just keep them in the back of your mind. So if your horse starts acting odd, you can be flicking through these and thinking, could it be colic?
Somebody sent through a question today about their horse was biting at the coronet band and was wondering whether that's a sign of colic. Do you want to just mention or respond to that question?
Yeah, absolutely. So she said that the horse had been biting at the coronet band a few days before. So to me, I think it's probably unrelated. although that could be a sign of very low-grade discomfort, but the fact that it was focused on the lower limb seems very unlike colic in itself. The horse then had colic that unfortunately passed away from a few days later. So those acute colic stages, they tend to be very short-lived. So I don't think signs a few days earlier would have been relevant in that situation. Wonderful. So let's delve into why do horses get colic? Because I mean, as a vet, I've been always very heavily focused on treating colic when it does arise, but often we don't get the opportunity to think, why did this happen and what can we do to stop it from happening again? Now, the first thing we need to do is take a look inside and really rewind. So the horse's digestive tract is enormous and there's multiple potential sites for colic to arise. I'm going to run you through the anatomy just to help you wrap your head around this diagram. So after the horse has chewed its food, it swallowed down the esophagus and it enters into the stomach. The stomach is the smallest component of the horse's digestive tract, and it makes up only about 10% with a capacity to hold about 9 liters. It's a simple stomach, which means it works in a similar way to a human, but the horse actually has the smallest stomach in relation to its body size of all domestic animals, which means they're really not designed to eat big feeds, which is something we'll go into later. Now, the stomach secretes hydrochloric acid as well as pepsin to begin breaking down the food. Following that, it passes into the small intestine, which runs for about 15 to 20 meters. So it goes for a huge length, and that's this curly-whirly structure sitting at the top. And it has 3 parts. We've got the duodenum, the jejunum, and the ileum. Now, most of the nutrients, so the protein, some of the carbs and fat, are digested in the small intestine, and most of the vitamins and minerals are also absorbed here. Then we get into the cecum. So this is this comet tail structure here sitting on the right side of the horse's abdomen, and this is the start of the hindgut. Now, the cecum is about 1 meter long, but it can hold up to about 30 liters of fluid, which is incredible. And it's the fermentation hub of the horse, and it's fueled by the hardworking microbiome consisting of the bacteria and some protozoa, and it's responsible for digesting fiber and any soluble carbohydrates that the horse eats. Then after the cecum, we move into the 4 parts of the large intestine, which spans about 3 to 4 meters in total. We start off with the right ventral colon, then we go to the left dorsal colon, then we do a 190-degree bend into the left dorsal colon, and then we finish off in the right dorsal colon here. And then lastly, we go into the small colon, which is where the fecal balls are formed, and then they're passed out of the rectum. So in total, the horse's gut is about 30 meters or 100 foot long, which I just think is incredible, Linda.
It blows me away. And I just want to jump in and say what I find fascinating about this is you mentioned the stomach being quite small, and you'll show some photos in a moment. But often, aside from colic, when things go wrong, when a horse is girthy, when they always go, it's the stomach. If you look at the point of the girth, it's actually from the hindgut. And you look at how big that cecum can be, that often when you get inflammation, it can actually affect horses movement to the right. And we find so many clients that we speak to that the horses are girthy. And I always say, what are they like going to their right? What's their right canter transition like? You get that systemic inflammation, it affects the whole gut. And it's massive, which is what these photos are showing.
Yeah, absolutely. And again, I think if a horse is girthy, absolutely do your gastroscope to rule out stomach ulcers, but girthiness isn't only correlated to stomach ulcers. You do have to go through that process to rule them out. But there are other things that can go on that us as vets find really challenging to diagnose, because we've only got a camera that can go as far as the stomach. Everything else is a little bit like no man's land.
Yep.
So these are some really cool pictures that I took from a whole horse dissection that I did a couple of months ago. And the first picture, the stomach looks big in comparison to everything else, but actually you could fit it in your 2 hands. And what was really interesting was that the horse was just on grass overnight. Then he got given a feed, which was only a couple of kilos in a bucket. Then we opened his stomach up after he passed away, and we found that the stomach was absolutely full. And I was like, to our eyes, that feed looked really small in volume. And it just made me realize how much we're overfeeding our horses with regards to bulk. And we're putting so much stress on the stomach and then the small intestine, which is why we're ending up with all these hindgut issues. Now, this is when we started to kind of remove the intestines from the horse's abdomen. And you can see here the point of the cecum, which is the tip. And then we're starting to pull out part of the large colon. But you can see how big it is. It's literally kind of bursting out of the horse's belly. And this here is the pelvic flexure. So this is where the colon goes from left ventral to left dorsal, and it literally does a 180-degree turn on itself, and it halves in size. So that's literally like a two-lane traffic jam trying to get into one lane. So we're getting a lot of issues going on in here with regards to reduced volume. And this is one of the most common places that horses can get impactions.
And when you look at it like that, I just find it amazing that digestive tract doesn't just digest food. It does so much more. It's this huge immune organ, and it has to be completely intact to keep bad things out and good things in. But then it's got to be fine enough to allow that to happen. It just, for me as a horse owner, I've had horses all my life. It's only been the last, I guess, 8 years understanding just how important the gut is. And I know we're focusing on colic, but I just want to keep coming back in and going, we have to let this horse's system do what it's meant to do, from grazing all the time. You mentioned the stomach, they make stomach acid all day long. So if we let it just, there's some quirks in it. That, 2 lanes into one is probably not best design, but still I feel like we've just underestimated or valued how important the gut is. It does so much. It impacts on everything for your horse.
Absolutely.
I love these photos.
Oh, they're amazing. And I cannot recommend highly enough, if you ever get the opportunity to go to a whole horse dissection, do it, because you will gain such a deeper appreciation for your horse and the way that they work. Now, Linda, you are incredible at explaining the evolution of the horse. So I really want to hand this slide over to you.
Sure. Look, I get very passionate. If we look at how long horses have been around, and yet in such a short amount of time, we have changed everything about them dramatically. Now, we can't go back to how they used to be. We don't have the land. We still want to ride our horses. We will transport them. There are things that we do. But it's time for us as horse owners to really understand that we are creating change. It's having a huge impact. I had an amazing conversation with an adventurer in WA. I don't know if she's listening. Sophie, if you're there, you'll know that I'm talking about you. And she just made the comment, how do we make what we do with horses okay for them? And if we look at evolution and think where they've come and where they are now, we've changed the way we house them. We don't always let them be with another, herd or paddock member. We've changed the way we feed them. And I'm guilty in the past of being caught up in picking feeds that were incorrectly labelled or marketed. We've got to start taking responsibility for the way we're changing our horses. And for me, what concerns me is things like, metabolic syndrome and laminitis and loose manure are becoming the norm where they shouldn't be. So that's why tonight is incredible, because we're talking about how do we go back to prevention. We do want to still compete our horses. We still will transport them. But when Lizzie starts sharing some of the stats and how much it increases the risk of colic, then you'll be doing everything you can to try and manage that risky behaviour. So it's about acknowledging that we really are changing our horses. And we have to, when you're showing responsibility for turning up tonight and coming to this webinar, but it's time for us to go back and go, how do we make things better for our horses? And I know the more I learn, I have changed so much for my horses, and it's hard as a horse owner. You think you just want to wrap up in cotton wool, but we need to go back to what they should be doing and manage those changes. So it's something I'm very passionate about. We'll talk later about stress. And again, I'll come back to how much stress impacts on that gut. And you can't even see what's happening sometimes. But anyway, that's just setting the foundation for tonight. It's about saying, look how long they've been around. In a blink of an eye, we have changed them dramatically. So thank you for letting me share that, Lizzie. Yeah,
no, it's amazing. I just think the fact they've been evolving for like 55 million years, and domestication only takes up 5,000 years. Like, that's literally 0.01% of their time on Earth. And we've done so much within that. So we really need to be taking that into account. So what can we actually do to reduce the risk of colic? Now, unfortunately, it's not a one-trick pony, but there are ways that it can be done. And it really comes down to you as an owner following this three-step approach. Firstly, you need to understand and be able to identify the risk. Second, you need to be able to support your horse through preventative strategies. And third, to truly be one step ahead, you need to be prepared to handle a colic emergency. Now, colic is a time-sensitive condition, which means that indecisiveness, a lack of preparedness, or waiting can potentially put your horse's life on the line. So let's dive into the actual risk factors for colic. Now, in the majority of colic cases, it can be really difficult to pinpoint the exact cause due to its long list of potential contributing factors. But in short, anything that changes a horse's routine can cause colic. But here are the established triggers that have been linked to causing colic. We've got diet, access to pasture or lack thereof, water consumption, stabling, exercise, weather, transport, parasite, vices such as wind-sucking, crib biting and weaving, medication use within the past 30 days, for instance, antibiotics and bute, and general anesthesia in hospital or even sedation out on the road by one of your vets. Now, there are no proven trends, luckily, between colic and breeds of horses or genders, but there are a few conditions that can be age or sex specific, such as mares who can get post-foaling colic because their uterus can literally twist on itself. We can get stallions who get inguinal hernias, and we can also get foals who can get something called an intussusception, which is where the gut telescopes in on itself, and they can get ascarid impactions, which is where the gut becomes blocked with ascarid worms, which is always really heartbreaking. So there's quite a long list there, but let me move my slides back.
Can I just make a comment? I think you made a really important point. Your first one was any change in routine. And we think about how often we change the routine for our horses. And if you're like me and you've got quite a few horses, they've got their routine. If one horse gets fed at a different time, the stress starts to happen. The change in routine, the change in weather, the change in, they go to another event, we put them on the float. That unpredictable, uncontrollable environment is really interesting. And just one other thing I wanted to say, that if you're listening to the information that Lizzie's sharing and you're feeling a little bit overwhelmed, like, how will I take this all in? I meant to say, and I don't think I mentioned, when we get to the end, Lizzie's got a really amazing offer, and also we have at Poseidon that we would like to share with you. And don't forget, we'll be sharing the prize. I don't think I mentioned that right at the beginning.
I know. We'll definitely be doing the prize draw at the end.
Yeah, sorry, I just wanted to say before I forgot, but let's keep going back to that change in routine, because these are the things that we can start to control.
Yeah, and you know what? I've got a little segue to go on that one comment because it just sparked a light bulb for me. But we think that even if we're keeping our horses' routine the same, so we give them a feed in the morning, they go out in the paddock, we bring them in, we give them another feed, then we stable them, we're actually starting to realize that that's a shock to the microbiome. Even us having a quote unquote routine for them is still putting the horse under pressure because they're having to adapt constantly. Okay, now I'm out, now I'm in, and I'm eating hay, and now I've been given a food, and we're like, wow, actually, even when we're doing our best, it's still not perfect, which is no wonder why horses get colic.
Yeah.
Anyway, let's get stuck into it. So during this class in particular, everyone, we're going to dive deeper on a few of the really, really important factors that I can then provide you with some strategies on to help you overcome them. So you've now heard Linda and I rant on about how horses are up against a number of different issues. They really started off as leaf eaters, and it actually took them 55 million years to evolve to switching poor quality grasses. And then since we've domesticated them in the past 5,000 years, we've moved them onto lush modified grasses, unfamiliar hard feeds containing starchy cereals, fats, protein, and dried forage. They also experience restricted feeding times and frequent changes in the amount and the type of nutrition. So let's dive deeper into the importance of concentrates.
Lizzie, just one thing I wanted to add there as well, because you mentioned microbiome before, and I think that we're not talking about that too much today, but the microbiome that live in the gut actually determines so much. And we do know that we're starting to wipe out species, because we know, look at our wild animals, and they have such diversity and depth of microbiome, and they can take, bark and leaves and twigs and things and actually use them. But we are now reducing the diversity of fibre in our horses' diet, and so therefore they're not getting that strength of diversity in the microbiome. So it's another way that we are having an impact on their resilience in the gut.
Yeah, absolutely. We're literally weakening them from the inside out, unfortunately. Yeah. So let's hone in on grains and concentrates for a moment. So we know that any inclusion of grain or concentrate increases a horse's risk of colic when compared to a forage-only diet. So this graph shows that the risk increases as the amount of grain increases. So we can see that if you feed a horse up to 2.5 kilos of concentrate a day, this over doubles their risk straight away. Then if there's more than 2.5 to 5 kilos of feed a day, we get more than a 4 times increase in the risk. And then lastly, there's more of a 6 times increase from baseline if they're fed over 5 kilos of concentrates a day. And it's just really common in competition horses. A lot of competition horses will fit into this category. So immediately their colic risk has been increased by 6-fold. Now, starch is found in cereals like oats, rolled barley, and maize. And why is it an issue? Because the horse's small intestine is very poor at digesting starch in comparison with other species. For instance, if you take something like rolled barley, which is 60% starch, they can only digest 20% of it in its raw form. Now, what happens is that these cereals, if they're undigested, they then travel into the large intestine, they start fermenting, and they cause digestive upsets through the production of gas, acid, bacterial death, and inflammation. Now, not only do we know that increasing the concentration of, or the quantity of concentrates is an issue, but we know that changing feeds between different types of concentrates also increases the horse's risk by 3-fold. So we're going to go into a few strategies of those in a second.
Can I mention, are we going to talk about feed labels in this section, or does that come in later? I know we spoke about that today.
We chatted about it a little bit in the next slide. So maybe I'll read that one, and then if you've got stuff to add, we can definitely go into it. But yeah, feed labels is always an interesting one. So what are the strategies that I've centered around grains and concentrates? So firstly, I'm going to advise you to always have a nutritionist on your horse's team when navigating any form of change. They are invaluable. And as much as vets, we know a fair amount about horses and health, we are not trained nutritionists. Okay. So I work with a nutritionist a lot when I come across a horse who looks like they could be doing better. And I tend to work with them in order to get a horse back on track. Now, ideally, if you're in a situation where you're unable to avoid grains at all, please try to feed less than 2.5 kilos a day, because as we know, if you go over this, you're instantly doubling your horse's risk of colic. Now, ideally, you want to give your horse feeds with less than 1 gram of starch per kilogram off their body weight. For instance, a 500-kilo horse should be getting less than 500 grams of starch per meal. Smaller feeds are always better, and they're going to help avoid undigested starch reaching the large intestine and being fermented. And this is where your nutritionist comes in really handy, because instead of you sitting down there with your calculator and trying to work off what the back of the bag is telling you, they can do the maths for you, so you make sure that you're staying within those values. Now, a really important thing to note is only use extruded or micronized grains. So essentially, these are the ones that have higher digestibility due to the processing. And if possible, go for alternative high energy feeds such as beet pulp, soya hulls, copra, and oils. Incredibly, horses can obtain way more energy from these feeds as well as their fiber instead of cereals and grains, because they've evolved better to digest them. So you think you're giving your horse racehorse mix to give it more energy, and actually you're probably better off giving them some soya hulls and more hay, in fact. And also, if you've got a horse that looks like they're a poor doer, they need to put on condition, calories from fat are amazing, and they can really help reduce your dependence on grain for energy too. Now, always make your dietary changes gradually. So ideally do it over 14 days, and any form of feeding change, whether that's the kind, the amount, the timing, or the sequence, these actually seem to be the most significant triggers. Again, because we're going to be putting the horse's body under significant stress, disrupting that microflora, changing the pH and the acid concentrations, as well as the concentration of volatile fatty acids. So avoid change as much as possible, but if required, do so gradually over that period of 2 weeks. And diligently check for mold contamination in your feed, because mycotoxins can also trigger colic as well as a bunch of other digestive issues.
You've explained that so well. And a couple of really key points to mention is that the reality is horses, as you said, they've evolved to thrive on fiber, and you will get most of the energy from the horses fermenting fiber and creating all that, I call it magic. And we talked about, you mentioned changing feeds is a huge risk factor. And this is where I get quite passionate again about reading feed labels. Go home after this, when you get off this webinar or tomorrow and looking at the feeds, please look at your feed label. If it says cereal grain and doesn't tell you what it is, that means it could change. So therefore, it could be a batch of barley. It could be corn next time. You actually don't know. So sometimes it can say usually contains. Well, what does that mean? This month it's containing corn, next month it's barley. We need to know, because that means it keeps changing. You could be feeding a feed that actually just says cereal grain or cereal byproducts, and all of a sudden your horse is doing something really weird. Is it because the type of grain that was used actually has changed. We actually don't know. The other thing is to be really careful, because some feeds will stay grain-free, but they'll have things like meal mix or wheat middlings. So be your advocate for your horse. I love looking at feed labels, and it's a bit challenging when you go home and look at your label and you go, really? I missed that. I didn't know that. And so if you're not sure, ring the feed company and say, please tell me, it says cereal grain, what grain is it? And if they can't tell you, then you might want to make some choices and choose another horse feed company that does tell you what they're using. So it's a homework activity for you.
Yeah, absolutely. And if you've got any questions, don't be afraid to get help from a professional. And do you know what? I see multiple feeds that are on the market that advertise as being like laminitic safe and low starch. And it's like, you go to look on the back of the packet and you're like, well, there's actually no calculation here for what the NSC content is. And there's information that's being withheld. So make sure you get your products from a company that's really transparent and you know exactly what's in the bag. So
Love that.
I know we could go to town talking about that one slide, Linda. But let's get into forage. So we know that adequate forage levels help to decrease the horse's risk of colic because it aligns with how they've evolved to live. However, there are some instances when a forage can increase colic risk as well. So recent changes, such as the type or the batch of hay, is going to put your horse at an increased risk for about 2 weeks after that change is made. And it probably has one of the strongest nutritional effects on colic. So the tricky thing is that the hay might look completely the same to you on the outside, but the nutritional composition can vary widely, such as like the sugars and the digestible fiber and the protein levels. The only way to really tell the difference is if you get each batch of hay tested, which is pretty inexpensive. So it's definitely worthwhile doing. And I'm going to go out on a limb here, but feeding in round bales as well can also increase a horse's risk, which is yet another reason as a vet, I don't like them. Because on top of their ability to trigger equine asthma and cause eye ulcers, they can also trigger colic. And we think that's because they tend to be of poorer quality. And the horse is standing there. They're not moving around at all. They're just standing there with their head buried in a bale of hay. And we know that exercise reduces the risk of colic. So we want them to be moving around. Now,
that's a tough one, isn't it? If you've got drought conditions and there's no capacity to put up slow hay nets and you want them eating something, like, is it about saying we know the risk, therefore we've got to manage everything else around it? Like, how do you then take that into consideration?
Yeah, and then storage. Well, storage of their round bales is really important. First off, they tend not to be stored as well as the square bales, so therefore the nutrients then starts getting leached, the quality goes down, and then potentially we get mycotoxins and other molds forming. But yeah, you've got to work within what you've got. But I know round bales are really convenient. But even if you can have your round bale out of the paddock, and then each day you come along, you peel off a few sections off it, and you dot those around your field. That way, your horse has got to wander around. They've got to move from one pile to the next, and they're not just going to stand there in one place, burying their head in the center of it.
Yeah.
No?
Thank you.
Okay, so what are our strategies for forage? So in order to reduce the risk of colic associated with forage, Linda and I recommend that you provide additional gut support to your horse for the 2 weeks following a change in hay type or batch. This is going to really support the microflora and keep the guts in homeostasis, which literally means balance. Now, again, I'm just going to go back into round bales. You might be shooting yourself in the foot by going down this route of them being more convenient. If they're not stored properly, they're going to be susceptible to mold and dust and bacterial growth, which cannot just cause colic, but those respiratory issues as well. And what you want to do is you want to limit alfalfa hay to less than 50%. So that's your lucerne hay, to prevent the presence of enteroliths, which are essentially calcium and mineral rocks which form within the gut, and these can cause blockages and can only be removed via surgery. One last point is avoid feeding hay on the ground if you live on a property with sandy soil, because horses can accidentally pick up sand with the hay they're eating, and that can accumulate in the gut and give them sand colic as well. So really manageable tips, but if you're someone that's going to be changing your hay every now and again, just supporting the gut from the inside out while you do that is going to be giving you one of the biggest benefits for reducing colic risk.
I think, Lizzie, too, everyday gut support using supplements that are complete, that actually provide, what we're finding is the more resilient the hindgut is and the hindgut bacteria are, the more they're able to cope with some of the stress. Because again, it's not realistic for us to go and buy 1,000 bales of hay, store them and keep it consistent. It's really challenging, and even getting hay analysis is challenging. But if we know these risks, some of the things I used to do, I remember, would be away competing, and we get to the vet and go, oh gosh, gosh, that oat hay looks good, and I like the look of that grass hay. I had no idea that I was creating so much risk of colic plus other gut problems. So it's about, doing what you can, but at least knowing that every time you change your hay, you're having an impact on the gut. So not only is your risk of colic increasing, but so is behavior and appetite and B vitamin production. It goes on and on.
Yeah, exactly. There's so many benefits to it. So let's delve into grazing. Now, we know that horses at pasture 24 hours a day have the lowest rates of colic because they're living in line with their evolution, grazing and ingesting high fiber diets. Now, as you can see on this graph, there's an inverse correlation between the risk of colic and time grazing, which means the more time out at pasture, the less the horse's risk. Restricted grazing, on the other hand, increases the chances of colic with up to a 30 times increase reported in multiple studies, which I just think is astonishing. But we're not immune by just turning our horses out 24/7. Grazing can be the trigger for some horses, such as those that get turned out into a new paddock with fresh, lush grass, because that grass is going to be higher in sugars and fructans, which can lead to excessive fermentation and gas production in the hindguts. This altered nutritional profile will also trigger colic, classically that spasmodic colic, which tends to do quite well with veterinary medical intervention. And also there can be changes in the grass that can happen due to the weather that can impact the horse's gut as well, which is something that is kind of beyond our control, but just brings us back to that point of your horse's gut needs to be resilient because we can't control everything, can we? Now, I hear a few of you thinking as well at this point, but what about my little laminitic or equine metabolic syndrome pony? They can't be out at pasture 24 hours a day. So I understand that their pasture needs to be limited or sometimes taken away altogether, but it's really important that we don't lock these ponies up and starve them. They need to still be getting their correct body weight percentage off forage a day. It's not enough just to give them a couple of biscuits of lucerne. So make sure you're working with your vet or a nutritionist to work out how much forage they should receive, and make sure you're using your low sugar hays and potentially even integrating straw as well to make sure they're getting enough bulk while making sure you're not going to spike their sugars.
Yeah.
So if you've got
I was
going to say, if you've got a laminitic EMS or PPID pony, I suggest you also talk to Linda about Metabolize, because that's a really awesome product. We can always kind of go into that in the Q&As at the end. Awesome. Was there anything else you wanted to add about grazing for the second?
Just going to say that, the point around the laminitic pony, that in the old days it was lock them up and give them white hay. Well, that, we know better now, and we know that starving them creates a stress response, which can create more inflammation, which can trigger more laminitis. So again, Lizzie, I love that you keep saying go to a nutritionist, because I get so frustrated at some of these nutrition forums on Facebook where people who are not qualified are giving advice, and it's not, and it's incorrect. So use nutritionists, and we do have a free feed program on our website called Feed Assist, and it's been developed. It's a mini version of Feed Excel, so it will let you pick gut-friendly diet. So it takes the guesswork away. It's fabulous. It just means we don't guess anymore, and we only let you pick gut-friendly diet. So that's an option as well if you can't find a nutritionist. But absolutely, as you said, Lisa, they're experts. This is what they do. So we've got to stop guessing.
Yeah, absolutely. And the thing I see all the time, Linda, is that by humans, we naturally overcomplicate things. That is exactly what we've done with our horses' diets. We've overcomplicated it. We've taken it too far away from what they're naturally designed to do. So we just need to be bringing it back to a good baseline, but working with someone to make sure that our horses are still getting their nutritional needs met.
Absolutely.
So I've got a few strategies for you with regards to grazing. So ideally, you want to be giving your horse 12 hours plus a day out at grass. When they're not grazing, you need to ensure that they're getting good to medium quality hay. A horse really shouldn't go more than 5 hours without food, unless that's them being kind of going to sleep overnight. So again, like your laminitic ponies that are locked up, they still shouldn't be going for more than 5 hours without their head next to a hay net. Now, it's really important that you transition them onto new pastures slowly, or implement strip grazing, like you can see this in this picture here. I've been out to so many colic cases where the owner's like, yeah, I turned them out into a new paddock yesterday. They were galloping around, they were loving it, and it looks amazing, but that sudden shift can instantly give the horse colic. Now, this is a really important one. You need to be aware of short turnout periods. Ponies are smart and they will quickly learn that they need to maximize their eating time, and they can actually consume 40% of their daily food intake in just 3 hours. So I always say, if you're going to be turning your lamanitic pony out to grass for a little bit, make sure you put a grazing muzzle on them, because that will reduce how much grass they can eat by 70%. So it will avoid you falling into this trap where they're just going in, gorging themselves, which is going to give them a big sugar spike, lead to an increase in insulin, and then trigger laminitis.
I got a great the other day from an amazing equine nutritionist, and she said, before you send your lamanic ponies out, give them some low sugar hay in the yard or in the stable so they're full before you put them out. Really tip, but a really great tip. And just one other thing I was going to jump in, that whilst we're absolutely advocating for grazing and forage-based diet, you still need to make sure you're meeting your vitamin and mineral requirements, because so many of our pastures are deficient in that space as well.
Yeah, absolutely. So important. I love that tip, Linda. That's a really, really good one.
It's a good one, isn't it? Yeah.
Yeah. Now, if you have your horses at home and you have the luxury of being able to choose when they go out, so you can consider turning them out in nighttime or the evening, because that's when the sugars are going to be less in the grass. And this, again, is another good option for laminitis. And also, if you have your own property and you have the opportunity to reseed your paddocks, make sure you're choosing low NSE grass species, because that's then going to help set you up for success. A lot of the pastures that I find in the area that I'm in, they've been modified to suit dairy cattle. And it's like, our horses aren't walking around producing 50 litres of milk a day. So no wonder we're running into issues having our horses on those grasses. So the one thing that I really want you guys to remember from this webinar is that a diet higher in roughage and lower in concentrates is better for reducing the risk of colic, as well as loads of other things like gastric ulcers and metabolic disease and laminitis. Now, your aim should be to build the diet around forage and only supplement with concentrates when absolutely needed. And just to put everything into some numbers for you, one study showed that for every kilo increase in roughage per 100 kilos of the horse's body weight, the risk of colic decreased by over threefold. Whereas for every 1 kilo increase in muesli feed per 100 kilos of body weight, the risk of colic increased more than threefold. So literally, one's going up, one's going down. So I'd love to know, everyone jump in the comments, are you learning something? Just say yes if you've learned something over the past half an hour, because I'd love to know that we're really hitting the mark.
Hands going up.
Good, amazing. So let's keep rolling. Let's go into water consumption. So intuitively, the first fact makes quite a lot of sense. A decreased water intake is going to increase your horse's risk of colic. And this is because feed material within the gut will become dehydrated and get impacted, which means it essentially gets stuck, especially in that spot that I showed you right at the start within the pelvic flexure. Now, interestingly, stabled horses with an automatic water drinker are at high risk. I thought this fact was really interesting. And I was like, but why is that? They've got water all the time that they need it. And it's because it's really difficult to keep track of water consumption with an automatic waterer. So as an owner, you might not actually know if your horse has stopped drinking or has decreased its water intake, which can be one of the first signs of illness. So for instance, if they're spiking a fever. So this is why we often see horses that have fevers, they get secondary impactions because the low water intake went under the radar and was missed by the owner. Now, the flow rate of these automatic water filters or water drinkers must also be adequate, because if it doesn't fill fast enough, then the horse may stop drinking prematurely. So studies have shown that you need to have at least a 6+ litre per minute water flow. So if you do have an automatic water feeder, offer up, and make sure you check with the manufacturer and find out what the flow rate is, because that's something really easy to double check. And if you get your new ones instilled, make sure that they're meeting that requirement as well. Okay, so what are our strategies around water? So this one is a given, but it still does surprise me how many times this goes, I guess, kind of unnoticed. But it's important that the horse always has access to fresh, clean water. Now, a horse needs about 5 litres of water per 100 kilos of body weight every single day. So that's about 25 litres of water for a 500 kilo horse. Now, it's really going to vary based on the temperature, the sweat losses, and the dry matter content of the feed. Essentially, you feed more hay, you need more water. More time out on grass, they're naturally getting water from the pasture. They don't tend to drink as much. Now, there are a few things you can do to encourage water intake and to help maintain hydration of the bowel. So I'd suggest giving your horse electrolytes during hot periods or strenuous exercise, because a horse can lose up to 15 litres of fluid per hour in sweat, which I think is amazing. And what you can also do is add salt into their hard feed. So for a 500-kilo horse, you're looking at about 2 tablespoons of salt up to twice a day. And then lastly, make sure your automatic waterers have an adequate flow rate. And if in doubt, offer water from a bucket as well to allow for you to monitor their intake. Have you got anything that you want to add around water before we move on to stabling, Linda?
I think it's also cold conditions. It's really hard as well, because
yes,
when it's really cold, that they've got the water's cold, they've got teeth sensitivity, and also they don't want to walk over and drink. So it's a tricky one. I'm lucky where I live, we don't get that cold, but I know people that in areas where it's snowing, that you can actually get those water warmers. But just monitoring the water intake. We'll talk about our stress paste later on, but it's also a product that I use regularly in hot weather because it's got betaine, which is a natural osmolyte, so it keeps those cells naturally hydrated. We just underestimate the impact of heat, and which is also linking to water. So I think you've covered everything, but it's also, the cold weather is also a challenge.
Yeah, absolutely. Like, having come from the UK, I have got very familiar memories of having to go out and crack the ice off the water buckets. And this is where weather really ties in. Like, colic is linked to the weather, but different parts of the world see different patterns with regards to the weather and the colic. So in Australia, I think our colic tends to go up in summer because of the extreme heat, and our horses are getting more dehydrated. Whereas in the UK, when we go through those change of seasons, so let's say you're going autumn into winter or potentially going into spring, that's when we see the biggest spikes of colic, because the water's that was getting too cold, they're not drinking, or we're putting them in a stable more often, or we're suddenly giving them more extended time out at grass. So again, it comes down to what is happening in my horse's environment that could be shifting their internal environment, and what can we do to protect them. Fantastic. So with stabling we know can add to the risk of colic, with the risk rising as the time in the stable increases. Now, the fact that the horse will be getting less fresh forage, more hay, and less exercise, this is just a recipe for a colon impaction in my eyes. And it's increased even more if the hay is poor quality. Now, they may also be under increased stress from boredom and lack of companionship as well. And if the vet tells you to put your horse on box rest for rehab from a wound or an injury, let's say, or if you just decide to keep them in for the day because the weather's rubbish, that sudden change in management puts the horse at high risk too. So what are the things that you can do in this instance? So first of all, make sure you're closely monitoring your horse's manure outputs, in addition to feed and water intake when they're stabled, especially if they're really used to being turned out. Now, you can improve their water intake by wetting down the feeds and adding salt, just as we've spoken about. And again, Linda, I think this is an awesome opportunity for stress paste to be administered as well, to help give us that little bit of a buffer before we potentially get colic arising.
Yeah, absolutely. And I think, again, it comes back to, we're talking about stress for all these things. They're all different types of stress. And again, when it's unpredictable and uncontrollable, and we change things, we know that they get what we call leaky gut. And we looked at the picture of the gut before, that big, long, one continual tract. But we know once that microbiome change, you're getting more lactic acid production. The gut wall can actually be eroded. If you think of it like tight shoelaces keeping the gut together, they can actually be eroded, which means then you're creating other issues around inflammation. So stress is so damaging. Sometimes we can't avoid stabling our horses. So how do we manage that? And again, stress paste, which we'll talk more and more about as we go on. It's the most amazing product developed by someone incredibly clever to look at all the ways our horses can be stressed. And you can use it in anticipation of stress, or you can use it during stress. And one of the things that we know happens when the gut microbiome is compromised, you then get less B vitamins being made, which can absolutely affect appetite. And so they're not eating. And so that's the problem. It just becomes this, cascade of problems. So that's when stress paste can be used. If they're being put into a stable for box rest from an injury, or they're really critical, you can give 3 stress paste a day for up to 2 weeks when they're really critical. But that's, only when real extreme conditions. But it's just one of those products that it's almost like a security that, you use that in case of stress and during stress. So we just forget how stressful stabling is. And people say, my horse loves his stable. And it's like, well, does your horse love his stable, or do you as the owner love knowing your horse is tucked away in bed at night? And I know horses get used to routine, but for all the things you've said, Lizzie, they're not walking around. They don't have their companions. They can't mutually groom. However, having said that, sometimes we have no choice and we stable our horses. So this is not about putting guilt or blame on anybody. What we want to say is these are the risks. Be aware of them, and therefore some of the risks, if you can't change, if you have to stable your horse, then manage every other risk that you can, so it's not just this, constantly building up as another risk and another risk.
Yeah, and I absolutely love having another tool in my toolkit, and now being able to recommend to owners who I've told them they've got to box their horse because they've got the bad wound and they're going to need to be confined for 8 weeks or so. Like, some of these horses have never been stabled, and all of a sudden, like, I've come out, I've sedated them, I've stitched them up in the middle of the night, I'm putting them on antibiotics, I'm putting them on bute as well, which we also know increase the risk factors. And then I'm asking them to lock their horse up, which is, they get stressed out from it. Like, you can see them box walking and they're unhappy, and normally the more your horse is fretting in the box, the worse the wound healing is going to go. So it's nice to have something I can give them to say, listen, give this to your horse a few times a day for the next week. It's just going to help them transition, and once they get used to it, we'll be okay. But we just need to get over that first 1 to 2 weeks while they get used to it. But I see the emotional toll. Yeah,
it's not a sedative, it's not a calming pace, it's a pace that supports the whole gut, so that it can try and stay as much homeostasis as possible. Sorry, Lizzie, I spoke at the top of you then.
No, that's a really good point though. That's the point, because often I have told owners, make sure you go pick up some stress paste, and they come back and they've got another stress paste that's just for calming the horse. It's got some B vitamins in. I'm like, that's not the one I had in mind. But that's the thing. There are other stress pastes on the market, but they are not formulated in the way that your one is.
Right. Yep.
Yeah. Okay, well, let's keep cracking. So now we're going to go into transport. So transport is the last one on my list of risk factors I want to talk you through today. So in addition to colic, transporting your horse increases their risk of dehydration, gastric ulcers, heat stroke, and shipping fever, which is an infection involving the horse's lungs and the fluid-filled pleural cavities that surround them. Now, one Australian study found that gastrointestinal issues accounted for 27% of cases requiring veterinary attention following transport. And this is because it puts them under stress. So I know Linda's just kind of delved into stress briefly, but just think about it. Does your horse ever resist going on the trailer, or do they show signs of looking on edge after being unloaded? Maybe they're on their toes as they trot down the ramp, or maybe they did a loose manure before they got on the float or while they were in there. Those are all signs of stress that we just kind of look over and just think they're normal. Now, this stress combined with dehydration, often associated with travel, leads to a decreased blood flow to the digestive system. And then if you pair that with the lack of forage and water while they're being traveled, in addition to the change of routine that they're going to be going through when they get there, the risk factors really start to stack up.
Yeah, and I think we've just said before that stress isn't just about anxiety. And I have people say, my horse is a really calm traveller. And it's like, but remember, you cannot see the stress that's happening in the inside. So again, stress paste is fabulous for transport because it's got the pectins, it's got the buffering for the stomach, but it's also got other ingredients to support the gut all the way along. And I think, Lizzie is so correct that we put them on there, we think it's okay, and then we arrive to the event and we want them to perform really well as well. But we forget how hot it gets in there, how confined, how dusty, they can't move around, they can't get their head down. We ask so much of our horses.
Yeah, absolutely. So there are a few strategies that we want to leave you with today to help you kind of mitigate the risk around travel, because we don't want you to stop going out and having fun with your horses. That is not the point. But we really want to make sure that you're doing your best to be able to support them. And so you can go out and compete and do as well as you possibly can. It will really give you a competitive edge if you address all of these things and you rock up at the competition. So the strategies that I recommend are, first of all, training your horse to load and stand relaxed comfortably in the float or horse box is really, really critical. So it's going to allow you to transport them safely, and they're going to be less reactive to the external stimuli, which will minimize their stress response. And then make sure your horse is hydrated before transport to reduce the chances of dehydration and heat stroke. So you can add some salt into their feeds in the days leading up to the event, or give them electrolytes. And then encourage the horse to drink on arrival. So add some molasses or little bits of water or apple into your water to encourage them to drink. And then here's a good one. Providing soaked hay on the float is actually going to increase the horse's water consumption and also has the added benefit of reducing dust inhalation as well, because they're going to be in a very confined space. And try and avoid dietary changes by taking your own hay with you to competitions. Like Linda said, you might get there and be like, oh, that hay looks nice. Oh, I'm sure my horse will love that. But actually, you want to try and keep as much as you possibly can the same. And especially here in Australia, where horses go on really long haul journeys, where possible, try and stop. I know it's a little bit easier said than done, but if you can try and intentionally get a couple of stop points mapped out on your journey, unload the horse, take them for a pick of grass, that will make the world of difference. And then lastly, help your horse have a resilient gut by giving them a gut supplement such as digestive EQ as a maintenance, and then supplementing with stress paste before, during, and after travel to give added support to that gut.
Yeah, perfect. The question, does soaked hay reduce the chance of choke while they're traveling?
That's a good question. I don't know if anyone's looked into it, to be honest. I would be surprised if it did, purely because they're choking because they're eating too quickly and it's physically getting blocked. Like it's more so due to the quantity of the hay and the way they're eating it, as opposed to the fact of, is it dry or is it wet? We find that we get dry hard feeds cause choke, whereas wet hard feeds don't, because the wet hard feeds have already absorbed moisture and they're a lot softer, so it's a lot easier for the horse to chew. But we don't get too much of a difference in the structure of the hay when we soak it with regards to how tough it is. So
so many people say they don't want to feed hay when they're traveling because they're worried about choke, and it's it's a tough one because you also don't want them having all the other problems when you don't give them hay. So some of the things I recommend is using a slow hay net. So they're only getting small amounts. Try and get their head down if they can. But I just saw that soaked and I thought that's a really good tip. I've learned something new because I have never thought about soaking it during transport. So that's, it's a great idea.
Yeah. And I guess this kind of says it all. I've never been called out to a horse that's choked on soaked hay. So maybe that's our answer. But again, feeding your hay out of small hay nets, just don't give your horse the option just to bury their head in there and go to town. So small hay nets are better. Okay, so we've been talking about stress paste quite a number of times throughout this webinar. So I want to hand this over to you, Linda. And could you just tell us all a little bit more about what stress paste actually is, and also give us some insights into digestive EQ and RP?
Sure. Look, stress paste was developed because I had a horse that we took down. We travelled from Wollongong down to Werribee, and I knew that he was an off-the-track horse. I didn't know about gut health back then, and I knew that the trip would be long. I knew by the time he got down there, day 3 of competition, he's going to be girthy, cranky, loose manure, lose weight, lose appetite, all that. And that's exactly what happens. So when we started Poseidon, and after we'd realised how important gut health is, I spoke to Dr. Nelda Richards and said, how do we create a product that can manage all different types of stress? Because we don't want to just sedate a horse, because then if we sedate them, their guts are still being eroded and now they can't actually tell you about it. So it's not a Band-Aid. So what we've done is come up with this complete product. It's non-swabbable and it's got amazing ingredients like the pectins, particularly for traveling, so that you're not getting that acid splash on an empty stomach. So you've actually got that protective coating. Betaine is the thing I love about it. It's a product that's not used a lot, but it's a natural osmolyte, which is why I use it for traveling and hot days. It just keeps those cell walls hydrated so we can reduce the chance of leaky gut. You have got B vitamins because we know when they're under stress, less B vitamins are being made. We want them eating and drinking, want their muscles supported. And then we've added things like amino acids. I spoke earlier about the tight, the shoelaces and keeping the gut wall intact. That's what we want our amino acids for. So horses that are under high stress through competition, traveling, all those things, they are more at risk of leaky gut. So what stress paste does is says, I need to support the gut from the stomach all the way to the end to make sure that all the gut microbiome is still supported. There is nothing like this product on the market, and we are so proud of it because it is used so widely now, particularly, as to before, in preparation of stress. But the amount of people that have said, while they've called the vet, waiting for the vet said, have you got any stress paste? Give them some stress paste. And it's been quite amazing how many times that early colic has been resolved. So particularly people, we had a client ring recently, and they travelled and they got back home and it got travel colic and there was no vet. They didn't know what they're going to do. Oh my gosh, we've got some stress paste, gave stress paste and it resolved. It's one of those things that you just keep in your tackle just in case. And because it's so popular, it now comes in a pouch. So you get 6 UMSs in one. But it truly is one of those things that have it. If you're worried about them, if you're weight competing and they're not eating, they're not drinking, give them stress paste. If you are traveling, I do it now whenever I travel my horses. Even if I'm going on a short trip, I just know it's hot, it's confined, it's all those things that we know is stressful for horses. So that is stress paste, but it's for acute stress. It's not something you give every day. It's for those acute times of stress. So if we flip over to Digestive EQ, that was our foundation product. And it's when we discovered that if we really want the horse to have the best foundation for health, we need to support the gut, make sure the right gut bacteria are in charge all the time. They're the ones that take the fiber and create, again, all the magic, the B vitamins, the volatile fatty acids, mucus to keep the gut wall protected. But you've got to support all stages of digestion. So Digestive EQ is for everyday gut support. But now we know the higher the stress, the higher the competition, the more traveling, the higher the grain diet, the more gut support they need. So we bought Digestive RP Racing and Performance, was released last year. And it's like EQ, but, magnified. So if you've got a horse that's in just low to moderate work and not really any grain, EQ, and not really traveling, EQ is the perfect everyday product. But if you've got a horse under more stress, then Digestive RP. And Lizzie, you mentioned earlier about those 2 weeks when you're changing feed or you're changing stabling.
Mm-hmm.
A gold shelf approach would be absolutely give them stress pace as you're managing, and that doesn't have to be every day. But if you're already feeding EQ or RP, you can increase the dose of that just during that time. So it's added, it's extra gut support. We know that leaky gut can occur very, very quickly. And so once that happens, you're increasing your risk of not just colic, but all those other things. So what I love about these products is they've been formulated by, amazing person with a PhD in equine nutrition, and there's science behind everything, because sadly, not all products have the science behind them. So they really are amazing. Stress paste is just that added extra security that you need.
They're incredible products. And I think we have some amazing testimonials for some of your very happy horses.
We are so blessed. Every day we get people sharing their story with us. And that's what I love about Poseidon. I love that I get to help educate and also share products that I'm so proud of, that we can make change. And we're always about what's right for the horse. And we have to stop guessing. Again, there are feeds and supplements on the market that won't give the results that the horse deserves. So if you choose not to use our products, then whatever you're using, please make sure that you understand the science behind it, that there is the evidence there. And for those of you who are using our products, I'd love you to jump in the chat and just tell us, what results you're getting and which products you're using. But it's exciting to be on this journey. And what I keep loving about this is that we keep bringing attention back to the horse's gut. It's the foundation for everything.
It's amazing. And since coming across your products, Linda, it's amazing how often it comes up in conversation with clients when I'm out on the road treating their horses, and they're like, oh yeah, my horse there just wasn't something quite right. They were pacing the field. They looked really poor. I started them on Digestive EQ, and within 2 weeks, they were a different horse. And I was like, wow, I'm not even prompting them for these answers. And I was like, they're just gushing with how much they love it, which is amazing. So it feels really good to have something that I can rely on as a vet in order to complement all the medical treatments that I give horses too. So it's fantastic.
We are proud that equine vets are going, these are products that we believe in. That's amazing. We are, but we work hard. We've worked hard to create products that we know vets would support.
Yeah, and make sure you guys stick around to the end, because we've got something really exciting to share you around those. Now, we're going to be moving into step 3. So we've gone through the risk factors, so the first part of that Venn diagram, and you now will have a much deeper understanding of just what we're putting our horses through in comparison to what they've evolved to do. Then I've provided you with some proactive steps to really help combat those risks, and we've delved into the role of gut supplements. But now I want to move on to my specialty, which is emergency management, the horse health assessment, and the emergency response training. Now, I'm really sorry to burst all of your bubbles, but despite implementing everything I have told you today, your horse might still get colic. No horse is truly immune, so how you handle the situation when it does arise is crucial. Now, when thinking about emergency response, I always like to come back to this quote, which is, you don't rise to the occasion, you fall to the level of your training. So we did a poll at the start. There was like 40% of you that had never done emergency training before, another 30% of you that had done just a little bit, or it might have been years ago. So I feel like there's a huge need for this in our industry. Now, we don't have time to delve into all of these in detail, but I just want you to know that this is an area that I have specialized in teaching horse owners about. And colic emergency preparedness can be broken down into these main categories. So you've got the horse health assessment, you've got how you communicate with your vet and what you say to them down the phone when you're panicked and wanting help. Then you've got emergency response, so what you do to help your horse while waiting for the vet. And also how you assist the vet so that the process goes smoothly and your horse receives the care that they need. And lastly, the possibility of your horse being referred to hospital and potentially needing colic surgery, which are all decisions that every owner should be prepared for ahead of time. Now, the horse health assessment is my favorite tool to teach owners because it allows you to collect valuable information about your horse's health. It allows you to feel informed about your decisions about what to do, and also have a high quality conversation with your vet over the phone, which could potentially avoid the need for a vet visit, but also help you get the help that you need when you need it. It also allows you to monitor your horse really closely in between vet visits, because if a horse has colic and they're in a hospital, we'll be checking them every 1 to 4 hours. If your horse has colic and you're out on the road, you might not be seeing your vet for another 12 to 24 hours. So that is a huge time period where things can turn south. And I really, really think that this is a tool that every single horse owner should know how to do. So I'm going to go through the steps and we're just going to touch on them so you know what is involved in a horse health assessment. So the first thing you need to be doing is assessing your horse's demeanor, because this is going to tell you what is their body language doing and what can that tell me about what's going on? Like, are they in pain or are they stressed? Then you want to move on to counting the horse's respiratory rate. And you want to do this from a distance, because as soon as you start fiddling around with the horse, the respiratory rate automatically is going to go up. So you want to get a true value by taking it from afar. And this can tell you anything about airway disease, any stress, or if the horse is in discomfort. Then you measure your horse's heart rate using a stethoscope. Now, the heart rate is one of the best indicators for how severe the colic is, and it might be the deciding factor between your horse going to hospital, staying at home, or potentially even being put to sleep. Then you can listen to your horse's gut sounds, also using a stethoscope, and this will give you an indicator of the type of colic and also the severity of colic that your horse has. And then you can take your horse's temperature. Now, this is really crucial and it can be a game changer with guiding treatment decisions. It can also help you decide if you need the vet or not, for a range of other conditions that your horse might present with. Then we've got your digital pulses, which can tell us if the horse is going into toxic shock, which occurs when the damaged gut wall starts leaking bacteria into the abdomen. This is a really serious sign and carries quite a poor prognosis. So being able to measure a digital pulse is so important for an owner, because not only can you give you an indication of this, but it can also let you know if your horse or pony is getting laminitis or an abscess way before they actually start showing signs of pain and lameness, which is exactly when you want to be nipping it in the bud. Then we've got the mucous membranes. These are most easily assessed by lifting the top lip up and looking at the gums above the top teeth. This will help you decide if the horse is dehydrated, they're potentially in shock, if they're lacking oxygen, or if they've got liver disease, all just from the gums. Pair this with the horse's heart rate, and these two together can give a major indicator as to the severity of the colic, and that can help us decide whether the horse needs to go to hospital, whether they can stay at home, or again, whether it's means for them to actually be put to sleep. And then we've got capillary refill time. So this is done on the gums and is a test to assess the horse's blood perfusion, which tends to become delayed as they get ill. And then it's really important to also note down any notes associated with manure output, how much water your horse has had, and any colic signs that they're showing as well, so you can really keep track and monitor them. Now, when performing your horse health assessment and relaying your findings to the vet, please don't just rely on memory or vague ideas. There's a lot that I just covered, and chances are you'll forget or relay some incorrect information to your vet when you're put under pressure and you're on the phone to them. So make sure you have a designated record sheet, such as this one that I've created specifically for the horse health assessment. It's got multiple rows of data entry, allowing you to monitor and track your horse's vitals, which can be especially helpful for those critical conditions like colic. And again, circling back, it allows you to give your horse the care that they might otherwise be receiving if they were in a hospital setting, because you can monitor them in between each vet visit, and then you can detect any subtle changes and jump straight on the phone to the vet, so you can keep them informed, and then you guys can work as a team and help make decisions based on what your horse needs.
Love that sheet, Lizzie. It's amazing.
love it?
I think it is so clever. And one day you're going to make a great big one for the fridge, to go on the fridge in the stable. I think it would be
100%.
It's such a clever tool.
I love it. And you can literally put it on a clipboard. I always laminate these sheets so you can write on it with a Sharpie pen, and then you can wipe it off, and then you've got that sheet reusable for the rest of your life. You can put it on a clipboard, hang it up outside your horse's box. If someone else needs to do the horse health assessment, they can do it and then keep track of your horse's vitals as well. This is exactly what we used to do in the hospital.
Yeah.
Okay, so let's say you've collected your information from your horse health assessment, and then it comes to relaying that information to your vet in a calm and confident way. And just by the way, the vets are always really, really impressed when you're able to call with this information, because it allows us to give you tailored advice. So one potential life-saving situation that always comes to mind is, let's say your horse is colicking and the vet is 4 hours away. You might live remotely, or the vet might just be at a big stitch up and a fair drive away from you. Now, if you call the vet and you tell them that your horse's heart rate is 80, you can't hear any gut sounds, they've got mild digital pulses, and their mucous membranes are dark pink with a purple rim around the teeth with a capillary refill time of 4 seconds. As a vet, I would be telling you to transport your horse straight to hospital instead of waiting for me to get there and do the assessment first. And the results of that could potentially be a life-saving surgery. So this is a horse that had a strangulating small intestine here. You can see where the gut's all inflated like a balloon. It should be nice and collapsed, so it's honestly 10 times the size. And this tissue is also looking dark and red because the blood flow is being obstructed. And the reason why it's got this condition is because this fatty lump in the abdomen, this lipoma, has lassoed itself around the gut and is strangulating it. Now, this horse would have died a painful death within a matter of hours if it hadn't received treatment. So can you see? Colic isn't a condition that you should just be sitting back and letting unfold. It is your duty as an owner to do all in your power to prevent this from happening. And you are your horse's advocate, and you really need to take that responsibility with the utmost seriousness. So what's the answer? And that really is you becoming an educated and equipped with with emergency response skills, so that you can confidently implement things to help your horse during their moment of crisis, but not just for colic, but for any unexpected emergency. So I want to ask all of you here, and I want you to jump into the comments and give me a yes or no. Are you ready to feel confident, empowered, and self-assured? So give me a yes. I'll give you 3 seconds. 3, 2, 1. Hopefully there's lots of yeses coming through, Linda. So I will have the pleasure of inviting every single one of you on this course who's obviously already an incredibly dedicated owner into my signature baby program that I've been working on for the past 2 years, the Equine Emergency Response Training. Now, the EERT will empower you to feel confident about how you care for your horse when they're sick or injured. You'll feel calm when faced with a high-stress situation. You'll feel empowered with practical knowledge and skills that could save your horse's life one day. You'll know exactly when to call the vet, saving you money and avoiding costly mistakes. You'll feel self-assured that you're making the right decisions on behalf of your horse with that real inner knowing of, I've got this. And you'll look back and feel proud of your ability to help your horse recover. Now, as a vet, I know it's a question of not if you're going to need to use these tools, but a question of when. And please just remember, you don't rise to the occasion, you fall to the level of your training. Now, throughout the course, you'll cover a wide range of emergency scenarios, equipping you with the necessary awareness, knowledge, and practical skills to feel prepared. You'll learn directly from me, an equine vet, and you'll get step-by-step guidance on how to respond to different emergency scenarios quickly and calmly. And because I know that emergencies can happen at any time, you will have lifetime access to the course materials, as well as access to a supportive online community. So if you want to hear from one of the hundreds of students that have already been through the course, these testimonials are all shared on my website. But one of my favourite stories is from Lisa, who had spent over £25,000 on vet's bills before doing the training. She's put her skills into action on multiple occasions, and each time her horse has made a full recovery. And she said that her training made so much difference, it allowed her to feel much more confident and give information to the vet in a way that was self-assured and concise. And then Samantha, who's from here in Australia, she honestly believes that the training has potentially saved her horse's life and that it should be mandatory for all owners. She now knows that she won't make unnecessary mistakes that she would have made in the past, which to her is invaluable. So what do you cover inside of the equine emergency response training? So we initially go through the fundamentals, which touches on your equine anatomy, really gets you up to speed on how your horse works. And then you go away and you build your own emergency response kit, because to be prepared, you need to have the right equipment. Then we delve into assessing the sick horse, and you master the horse health assessment so you can gather that vital information. And I also teach you how to interpret your findings. And this is a skill that is one of the favorite things each student loves learning. Then we delve into colic. So what we've covered today is really just scratching the surface on the subject of colic, and it's one of my favorite things to teach. So I'll help you distinguish between the different types of colic, and we'll delve into false colic, exactly what to do and not to do in emergency, how to be prepared for hospital and potentially surgery, and other topics like diarrhea, peritonitis, choke, and gastric ulcers. Then we go into lameness within the foot, how to confidently assess or identify lameness and assess the foot, and really nail how to take a digital pulse, because that can be quite a tricky skill to master, and also how to use hoof testers as well, because those are really handy. You'll learn how to approach laminitis, penetrating sole injuries, keratomas, nail pricks, and abscesses. And then after that, we start traveling further up the leg. So sorry, that should say lameness in the limb. And you learn how to assess the limb to identify tendon and ligament injuries, as well as joint pain. You'll learn how to bandage the lower limb like a pro, and we'll go into cellulitis, bone fractures, tendon and ligament injuries, string halt, and peroneus tertius ruptures. Then in week 6, you go into wounds. So how to stop bleeding from a wound, because you don't want your horse to lose a ridiculous amount of blood from a lacerated artery and then require a blood transfusion. And then you'll also learn how to do the more advanced bandaging techniques over hocks and knees. You'll learn thorough wound treatment and ongoing management to really support healing and avoid proud flesh, and what to do in emergency wound care, joint infections, and really interestingly, a pneumothorax as well. Following that, you move into eyes. You learn how to assess the injured eye, what special eye care you can do at home, and you'll learn about conjunctivitis, corneal ulcers, and uveitis. And then you finally go into medication techniques. So how to give eye, oral, and intramuscular medications and injections, and how to avoid and deal with any adverse reactions to medications that your horse might have. So those are the core modules, but it doesn't stop there. We run 8 case study seminars. So this is where I jump on Zoom with you and we go through various case studies. So you really have to put your thinking hat on, and I teach you how to approach each scenario, and we cover a wide range of topics, everything from fevers and tying up to snake bites to allergic reactions and nosebleeds and burns and emergency rescue. So we really go deep and have good fun with those. Now that's all the core content, but it's not just stopping there. We've also created a bonus webinar library for you, so you can go even deeper into the subjects that really interest you. So I've got a 2-hour laminitis webinar with Beck Ham, who's a nutritionist from Kentucky Equine Research. We've got a wonderful webinar about how to train your horse for emergencies. We've got an equine gut health and supplementation webinar with Linda, and also natural remedies for equine emergencies with the wonderful naturopath, Sue Martin. And that's a $200 bonus value for that webinar library on its own. And the next time I run a live course, I'm going to continue to add to this library. So it's going to be a really valuable resource for you to get your hands on. Now, Nicola was a really incredible student from 2022 who's an equine body worker back in the UK. She loved the delivery and the depth of the training, and says that as an owner and equine professional, she highly recommends it. And Helen, an incredible owner from the UK, also highly recommends it too for any owner that wants to expand their horse health knowledge and feel confident to take care of them during an emergency. She especially loved being part of the knowledgeable and supportive online group that she knows will have her back for years to come. So there are two ways that you can join the Equine Emergency Response training, offering you complete flexibility. So we've got the self-study course, which is for all owners who want to take the course at their own pace. Now, you do receive all of the comprehensive core content that I covered, but all the content is pre-recorded. So you get 10 hours of the case study seminar recordings, you've got 17 practical training videos, you've got an 80-page emergency handbook, you've got the workbook, you get lifetime access to everything, and you can access it both through the website and through a handy mobile app. So if you're in the middle of a paddock, you've got someone that you can instantly jump onto. You get lifetime access to these, as well as the support Facebook group, and you get some guidance emails for the first 8 weeks from me, just to help hold your hand and support you through the first 8 weeks of the course. And you get access to that bonus webinar library too. Now, the live group training, this is only run a few times a year. And I think in 2024, I'm only going to be running it twice, and I'll be going on an extended break while I travel around Australia and run some emergency workshops. Now, this one's really for those dedicated owners and equine professionals, and it runs specifically for 8 weeks. So the next one is going to be starting on the 22nd of January, 2024. And this is a really interactive, enhanced learning experience with live support, guidance, and accountability from me. Now, you get 8 weekly live case study seminars as part of this. So we get together on Zoom every Wednesday night, and we'll go through this case study seminars with me in person. So if you've got any questions, the floor is yours. I'm happy to go down any horse health wormhole that you want during that time. And you also get the practical videos, you get the emergency handbook and the workbook, which not only do you get in a digital form, but you also get in a really nice physical handbook form as well. Oh, my webcam won't let me show them to you. And you also get personalized feedback on all of your practical assessments. So throughout the course, I think knowledge is great, but your practical skills are paramount. So I get you to put the practical tasks into practice. You video them and send them back to me, and I give you one-on-one feedback to let you know just where you can tweak your technique to make sure you're feeling 110% ahead of needing to use it in a real life emergency situation. You can access things on the website, the mobile app. You get lifetime access to the Facebook groups. You get a certificate award upon completion of the course, and you get the webinar library, as well as a $200 bonus printed training bundle. So that's where I send the printed resources straight to your house. So not only do you have things online to look back on, but you've also got these incredible resources. Now, the prices that are listed on the bottom, that's the normal investment for the course. But for this webinar, I'm doing a really special 20% off, which I have never done before. This is only going to be for 72 hours. So the self-study course you can enroll at for only $800, or you can start a payment plan at literally $149. I swear to you, you'll earn this back within 12 months. And the live group training, you can save $400, so it's now $1,597, or you can start a payment plan at only $369 a month. Now, both of these expire at $11.59 on Saturday, so make sure you jump on these. And the live group training, it's normally only held as a waitlist at the moment, but I'm opening it up for super early bird enrollments just for this weekend. For you guys that are on the webinar, I limit the spots to 30 people in the live group training. So if you want to be in the January training, and like I said, I'm only going to do 1, maybe 2 of the live courses next year, I would be leveraging this opportunity. Not only do you get to save $400, but you get the $200 bonus hard copy training bundle, and you're getting the $200 webinar library, and you'll also get a couple of stress pastes as well. So that's over $650 worth of bonus content that you'll get your hands on. And for anyone that decides to jump on the bandwagon, you say, yes, I'm in, I'm going to do this tonight, I'm going to send you a duo pack of stress paste as well, as an extra thank you, and just to celebrate you for taking this incredible step forwards to help support your horses. So if you want to get hold of all of this plus the stress paste, make sure you enroll before the end of the evening, because the stress paste will be disappearing as of midnight tonight.
Lizzie, it's amazing. I think about, how do we learn these days? We don't. We're not learning. We're not empowered. We're not. When I was young, we used to go to pony club. We learn a lot then, but the skills and the knowledge that you share in these courses is incredible. And I look at the price of that and how much effort's gone into that, and think, gosh, it's such incredible value for money, and it only takes a few vet visits that would cover that so easily. And then you've got those skills going forward. So such an incredible opportunity.
Good. Yeah. And I think about it as like, I have invested over $100,000 in my own education to get to where I am. Plus it's then like the past 12 years of experience, and you can get your hands on a significant chunk of what I know for less than 2%. of what I've had to spend to get to where I am. So it's such a good fast track, and these are skills that you will hold on to and cherish forever. And before we kind of delve into the final leg of this webinar, I've just got 2 more students that I want to share with you before we wrap up. So Simone is an incredibly dedicated owner from Canada. She said, just do it. It is so worth the money. I feel so empowered after doing the course and never expected to learn so much. And lastly, Jess, she's a vet nurse from Australia and said that despite being a trained nurse, she's so glad that she did the course to better know how to look after her own horses. She said it provided her with a wealth of knowledge and confidence, knowing exactly how to respond in an emergency, when to call the vets, and what information to relay down to them on the phone. So that's pretty much all from me, Linda, but I know that you have something special to share with our guests from Poseidon too, and we need to do our prize draw.
We do, exactly. Again, so we've never done this before either, linking it to a webinar, and because we are so grateful that you've showed up tonight, and we want you to be able to appreciate I think the brilliance of our products. So we have a bonus special as well, and we have a code for 20% off Stress Pace, and it is time limited. It was on there. I think it's 72 hours. Oh, no, it's up the top there, sorry, until the 4th of the 11th. What's the date today? So we've got, finishes. So that makes it Saturday. But it's such a great, we don't sell Stress Paste at that so cheap. And this is a chance for you to stock up, particularly, having something put aside in your tack box, have it there as a backup. It's one of those products you don't want to run out of. So amazing opportunity to get our Stress Paste at such a discounted price. And again, going back to Lizzie's course, I've sat in on some of the sessions that she's done, and what I love is that she explains it in a way that's understandable, and you know that you can do it. And therefore, it does take that sense of feeling helpless, particularly when it's really hard to get a vet these days. It's, and they've got so many pressures as well, that if you can then do the majority of the work and use the vets when you really, really, really have to, because, gosh, they're such an incredible resource. What an amazing skill. So, Lizzie, on behalf of all the horse owners, thank you for putting this course together. And I'm hoping everyone just takes advantage of this great opportunity. And even if it wasn't discounted, it'd be like jump in and sign up for it. Because I also like that you're getting that baseline data, that health assessment. If you do that regularly, then, not even when they've got signs of colic, if you made that a regular once a week, for example, you're getting some baselines. So you can start to see when things are changing, which I think is fabulous.
It's so good. And I was going to say, Linda, I've put a link for you guys to go onto the website to access this special deal into the chat. So make sure that you click on that link and you get in there quickly. Like I said, the spaces are limited for the live training, so make sure you use this opportunity to get in there before anybody else. And if you've got any questions, I can see 48 Q&As in our little bubble at the moment. So what we'll probably end up doing is we'll select a few of them. And then what we'll end up doing is I'm more than happy tomorrow, Linda, to sit down and actually answer these quick Q&As, and we can send them out in an email. I can write a Google Doc, and we can compile them together and just make sure that everyone who has asked a question today, I want you to feel like you've definitely had your question answered. Okay, so we'll put the time in tomorrow to answer all of those, but maybe we can select a couple out while we do the prize draw. Hopefully, Linda,
can you start looking at questions? I'll chat to my team behind about how we're going to randomly pick someone.
Wonderful. And what I'll do is I'll leave these on the screen for everyone to look at while we do that, because I opened up my Facebook feed and I found these 2 beautiful posts by students that have just finished doing the 8-week training with me, and they literally posted these all off their own back. So I thought I must screenshot them. They obviously come across my feed for a reason, and I thought I'll pop them in here. So let me get the Q&As up. And if you're there looking at the link at the moment, if you decide to sign up here and now so you can get your hands on those Stress Pace, come back in and jump into the webinar chat and say that you've enrolled so that I can celebrate you. Because I cannot wait to be welcoming you into the emergency response training. It's such an awesome community, and we've got about 100 horse owners in there now, so it really is amazing. Okay. Linda, let me know when you're ready to do the prize draw. And this is such a good one. $350 worth of goodies for turning up to a webinar. I love the fact that we've been able to offer this to you guys. Okay. Let me have a look. Oh, amazing, Courtney. Good to see you here. Wonderful. Okay.
Am I unmuted?
Yes.
I can talk?
Yeah.
Okay, so the lucky person to win this amazing prize is Kate McPherson. So
Woohoo!
well done, Kate. And I mean, jump on and give us a high five. That is such a great prize. And we will have your details. So we will be in touch about that tomorrow. So I think, you're going to answer some questions before we finish. We're just hit right on 9 o'clock.
Just hit right on 9. Yeah, I'm just trying to skim through them. So there's a lot of comments as opposed to just questions. Oh, well done, Kate. So great to have you here. I'm really excited to share the horse health assessment training bundle with you. Oh, can you overfeed salt? What is the recommended dose, please? So, Hayley, my understanding is that it's up to 2 tablespoons of salt twice a day. That'd be for a 500-kilo horse. And yes, you can overfeed anything. So we definitely don't want to be doing too much. The major issue with overfeeding salt is that it will make the feed unpalatable, so your horse won't want to eat it. That's the main issue that I find. Linda, have you got anything to add for that one?
I agree. I know there's research around too much salt in human diet can affect the microbiome as well. So to be honest, I have nothing else to add to what you're saying. And often we find there are, particularly when it's coming to the microbiome, often have more questions than answers. We are learning so much about how sensitive the gut is. So even with salt, I think when you're adding things in, just be mindful about the impact, and that rather than just going from 0 salt to 2 or 4 tablespoons a day, you might want to just introduce that slowly.
Yeah, exciting. And there's a message from Joan. She was saying that she wanted to sign up for the live training. Amazing. So I've just sent you the link. And again, make sure everyone jumps into the chat and clicks on it now if you want to. There we go. Lots of people saying thank you. Oh, okay. Is betaine in Speedy Beat? Do you know that answer, Linda?
I don't know that answer. I've never heard of it being in Speedy Beat. Don't know. Good question. Yes. I'd find the answer to that one.
That's a good one. And then Lib was asking, is there a code needed? So I'm assuming that was for the Poseidon one. And yes, this is the code SPC20. So everyone jot that down on a piece of paper and make sure that you've got it written down. And then Daphne's going to be signing up as well. Amazing. Daphne and I did a workshop together and Tassie, and Daphne's doing some incredible things with regards to getting more nurses out there helping horses. Her business is called Nurses for Horses, so Nurses for Equine, so keep an eye on that. Oh, and Maya's saying, will the payment plan only be available at the full price? So you've got the payment plan on both of them. So it is always a little bit more to do the payment plan as opposed to the pay in full. You get an extra discount if you do pay in full. But the payment plan will probably end up increasing as we get closer to the start of the course as well. So it's best to just jump on and get it done now, because there's a discount on both payment plans for the next 72 hours. Okay. Lisa said a good one. Could you just confirm that you were advising that we should not be feeding our horses muesli type feeds, or is there a certain type of muesli?
Another hour.
I know. We'll do 2. We'll do this one and one more.
Can I jump in first of all?
Please.
The reality is that most horses can do very well without grain. Their digestive system is not designed to process grain. We know that, as Lucy mentioned, starch is digested in the small intestine, and what's not digested there ends up in the hindgut, feeds the lactic acid producing bacteria, that then they increase in numbers, they kill the good bacteria, and then havoc happens. So for me, it's about only bringing in grain when you really need to. Now, most muesli feeds are very sweet. So it's a bit like getting, I always use Cocoa Pops as an example, those really sweet cereals. They might taste good, but they're not good for us. So for horses, I personally would never recommend a muesli feed unless they're in a situation where they were critical and they weren't eating at all. I know that in some of the vet clinics, when the horses are not eating, they just want them to eat. So they may feed a sweeter food. I don't know, Lizzie, if you want to comment on that in a critical situation. But for me, most horses do not need grain unless they're a high-performance horse, such as a racehorse or an eventer. We also know lots of eventers that are competing at the highest level, at Olympic level, without grain, because the bacteria take fibre to make energy. Most energy comes from the engine of the horse, which is the hindgut. So muesli feeds have been around for a while. I have fed them in the past. I wouldn't feed them again because they're sweet, they're full of starch, and horses are just not meant to digest starch like that. Lizzie, what would you like to say?
Yeah, absolutely. But it's like there are certain cereals within the muesli that have different levels of digestibility. So it's mostly you're looking at corn, maize, and barley, and I can't rattle the figures off the top of my head right now. But that's something that we can delve into in a Q&A when we write it up in a Google Doc, Linda, and send it out to everyone, just so you can get an idea of actually like which grain is best out of all of them. And because the one that you select does make a difference. And then again, making sure that it's a processed grain. In humans, we try to stay away from processed foods, but actually horses need to have these grains processed if they're going to stand a chance of digesting it at all.
Right. So again, back to looking at your feed labels, make sure just because it says steamroll, that's not enough. We want it extruded best and then micronized, which means that the starch can get taken up by digestive enzymes, of which we've added to digestive RP. We've added more starch enzymes because we don't want starch getting into the hind gut and creating havoc. So, muesli feeds, for me, they're not your first choice.
Yeah, exactly. So many other better options. Now, I've got two questions that are literally related to colic, and then we'll wrap things up. Okay. So this is one of my favorite ones. I hear this all the time. My grandfather was a bushy and swore about using a bottle of stout or warm beer to help with a colicky horse. Is this an old wives' tale? And someone else has chipped in and said, I used the beer on a colic horse in the past and it did help. Also, an old vet suggested warm water and plenty of molasses also helped on another occasion. So in both of those instances, my personal experience has been that it's something the vet will tell you to do in order to make you feel a bit better. It makes you feel better that you're actually doing something. Really, when I give a horse fluid therapy, I'm giving them 7 or 8 liters. So if you're giving them 1 bottle of beer, chances are it's not going to make a huge difference. And normally the issue is going to be way back in the hind gut. You've got to get through meters and that beer's got to get through meters and meters and meters and meters of gut before it might potentially reach the issue. So by the time it's gotten that far, it's really not doing a huge amount. Now, there are a lot of cases of colic that if we just gave the horse time, they would get better on their own, So I think that is more so what is happening. And also the other issue that I have with people giving liquids to their horses are how are you getting it in there? Because getting your horse to actually drink or ingest something isn't always easy. And if you're forcing something into their mouth, you might accidentally let it go down the trachea, which could go into the lungs and give them a pneumonia. So I would definitely be saying, if you want to do something in the moment, give them a stress paste. You can always see how that goes for half an hour if they've only got mild colicky signs, but I'll be waiting for the vet to get there before you even consider giving anything that's fluidy to them. So that's always my top advice. And then this last question, and then I promise we'll answer all of the others tomorrow. Someone said that they lost a horse to colic. They said, I believe a thunderstorm at the time added to his death because of the barometric pressure, making it worse. What do I think? I agree with you. I couldn't find this in writing anywhere while I was doing all of my research for this webinar, but that is something that I've heard in the past, that as the atmospheric pressure shifts, it causes a shift within the gut pressure or the gas pressure within the horse's gut, which can then lead to colic, which is why we often see like colic storms. So I find I'll see like 5 colics in a week, and it's normally because we've gone through that shift in weather. So I think it can play a part as well. So yeah.
What if it's stress as well, though? Stress,
a component of it.
Leaky gut. I don't know. It's really interesting.
Yeah, everything together.
We need to finish up. Look, thank you, everyone. We have still had so many people stay around to the end. Lizzie, thank you for your generosity in sharing your incredible knowledge and making it easy to understand. And I know that everyone that stayed with us tonight has learned something new. I know I have. And it's been an amazing hour and a half. It's gone so quickly. I know how much work you put into this. And for people who are sitting on the fence about the course, I can only say to you that Lizzie has been so committed to making sure this presentation was the best it could be. I can only imagine how incredible her course would be. So this is an opportunity that you're not going to get very often. Sign up for it. I'm sitting here thinking, I wonder if my daughter would sign up for this course. I'd love her to do it. So thank you, everyone, for coming along tonight. Thank you, Lizzie. Thank you again to all the Poseidon team for helping with all the, setting up for tonight and making sure it ran smoothly. And thank you, everyone, for being incredible horse owners that just keep wanting to learn. Because Lizzie said it before, I've said it before, we have to be the advocates for our horses. Think about how much we've changed their life through evolution, that it is our responsibility to try and make their life as stress-free and as enjoyable as possible, because they make our lives I wouldn't say they make our lives stress-free, but they certainly make them enjoyable. So thank you, everyone.
Yeah.
Lizzie, so you'll be answering the questions. We will be sending out a recording to everybody so that, you get to watch this again and get answers to all the questions that have been sent through, and really can look at the polls and see what everyone's been saying. Kate, well done on winning the prize. We will be in touch with you. And again, thank you, everyone.
Amazing. Thanks, everybody. Thank you. We'll speak to you all
Lizzie.
later.
Bye.
Bye.